Hello, my name is Heather Pilch. I am a master's student of athletic training at Indiana State University, and today I'm making a reflection video on an interprofessional event that I went to on rural health. So the first question is, what did you learn about other healthcare professions? The other healthcare professions that were there along with the athletic trainers were occupational therapists and physical therapists and nurse practitioners. I am actually well versed in all of these three because I originally wanted to go into physical therapy, but through some of my experience and volunteer hours, I kind of switched gears and just wanted to be more hands-on when the injury actually occurs, and then work through the rehabilitation process that way. And then with occupational therapy, one of my best friends, she is actually applying to programs to be an occupational therapist currently. So I had the opportunity to sit in on some of her volunteering hours and watch what they get to do. And then my mom, she is a nurse practitioner. She does not currently practice as one, but she is very passionate about her job. She's an emergency room nurse, and she actually really enjoys bedside nursing, so that's how come she doesn't practice as an NP. But she pursued nursing, and she wanted me to pursue nursing, but through all my experiences, I found my own path, which was athletic training. So the second question is, what did other healthcare professionals learn about athletic trainers? Well, I think they actually learned a lot from this experience because they learned that we're not just on the sidelines, we're not just working with athletes, that we're also in industrial settings. We work with the military, with firefighters, police officers, we work alongside the theater, or just anyone that has an active lifestyle. There's a need and a cause for an athletic trainer to be there and help take care of them. So the third question is, why is interprofessional education so important to patient care? I think it's very important, especially in some of these rural areas. The patient is always going to be the first priority in getting their needs met and taken care of. While ATs, PTs, athletic trainers, nurses, we all have specialized skills, it's going to be important for the healthcare professionals to work together, especially when it comes to referring out for these different patient needs, as well as knowing the availability of these healthcare professionals and how far the patient might need to travel, or coming up with different accommodations or in order to get these patients' needs taken care of. Okay, so the fourth question is, how will this impact your clinical practice and patient care? At the event, we talked more about rural health, and honestly, I can say I did not know that much about rural health and the specific demands and needs for these patients because I come from a more urban city-like environment, and I anticipated going back to that. And it honestly piqued my interest hearing some of these numbers and about these patients that live in these communities, because I know at the end of my schooling I will have these specific skills and the ability to be creative and create different programs or just better serve this community. And I also got to learn about the types of patients that you get to serve, ones that are hardworking, motivated, and determined to get back to their physical fitness or optimal health. And I thought that was very intriguing to me. And as far as clinical practice, I personally want to work more strength and conditioning, rehabilitation, and I feel like being able to refer out to some of these specialists like physical therapists or occupational therapists in order to continue to rehabilitate our patients and work together, I think that will be a key point in finding success in these regions, as well as just being able to better serve these communities.